A scathing letter to the province from Ontario's nurses. They say long-term care homes are in crisis mode and registered nurses in these facilities are working in what they call unfathomable conditions. They're now calling on the province for the most basic necessities to do their work safely. Perhaps the most disturbing revelation in the letter: some nurses are not even able to access masks when caring for COVID-19 positive patients, putting them and residents of these homes in grave danger.
It is like wildfire. What's happening in long-term care right now is shocking.
There have been at least 90 COVID-19 outbreaks at long-term care homes across Ontario. Even before the pandemic, the Ontario Nurses Association tells us the homes were understaffed. And since the pandemic, 190 homes have requested more staff. Today, the ONA called for more personal protective equipment and an immediate strategy to separate COVID-19 residents from non-COVID-19 residents.
They need to do everything they can to support people who are living there, the residents certainly, but also the staff.
Their call to action just in time. This afternoon, the province announcing new measures.
Today, we're throwing everything we've got at our long-term care homes.
Ontario's premier says he is mobilizing every available resource and stopping at nothing to protect those who can't protect themselves. That includes deploying more staff to homes, more testing at homes facing outbreaks, ensuring staff at those homes have the tools they need, strengthening protocols on infectious disease prevention and control, and restricting workers to one facility to limit spread, something the ONA has been pushing for years.
This isn't new, and this issue has been problematic, and it was raised in an issue during SARS.
The province also prioritizing distribution of personal protective equipment, the premier making this promise.
We're getting PPE to long-term care homes in need within 24 hours or less.
But experts in the field say more should have been done sooner to save lives.
It's really more of a broad societal problem that we just haven't put money into this.
They've been preparing for outbreaks like this since SARS and every flu season since.
We track institutional outbreaks, and there's carnage every year. If we weren't prepared because we had no idea, that's one thing. But we knew perfectly well what was coming, and yet we do nothing with long-term care homes.
PPE shortages are not just a problem at long-term facilities. Hospitals have been reporting shortages since the very start of this pandemic. The Ontario Nurses Association tells us that they're replenishing supplies for about 5 to 7 days on average until supply chains improve. They believe the same is true for long-term facilities. For City News, I'm Tina Yazdani.